Welcome aboard, everybody. Dr. Peter Glidden here, your steadfast advocate for health, welcoming you to another live edition of Fire Your MD Now, my absolute favorite radio program in the world. And I hope that it's yours, too, because what we talk about here every day is information which is literally, not figuratively, literally life-saving. Perspective that we bring to bear on the way that medicine is delivered, the way that medicine is designed, the way that medical data are interpreted through the reductionistic lens, which is an old-fashioned, outdated, anachronistic, Machiavellian, mediocre, dangerous way, and the more contemporary, holistic way, which is, the undiscovered country. Very few physicians in the world are actually schooled in and have any clinical experience with the practice of holistic medicine. And this is a very important distinction because, just like in politics, there are different philosophical ideologies. Well, there are different philosophical ideologies in medicine, and most people find that hard to believe, but it is in fact the case. I mean, the most telling example of this historically is Galileo. Galileo being thrown in jail because he was brash enough to assert that the Earth goes around the Sun, that the Sun is at the center of the solar system, that the Earth is not at the center of everything, that it's a heliocentric universe with the Sun at the center, not an Earth-centric solar system. This was a great big blow to conventional scientific wisdom, scientific wisdom, scientific wisdom. After that, of course, it was, the Earth is round. Oh, that was a big controversy. Of course the Earth isn't round. The Earth is flat. How could it possibly be round? Things would fall off, right? So inside the world of science, there are philosophies which are correct or incorrect, or which are jaded or biased a priori or not. And the medical model espoused by your MD is reductionistic medicine. It's not medicine, it's reductionistic medicine. There's no physician in the world that practices medicine. That's like saying there's a preacher in the world that practices religion. Well, no, there's not. There's a Baptist, there's a born-again Christian, there's a Muslim, there's a Hindu, there's a Buddhist, there's a Mormon, there's a Roman Catholic, right, et cetera, et cetera, et cetera. There are different types of religion. There's no one pastor in the entire world that practices all religions. It doesn't exist. Nor does it exist in the world of science. Your medical doctor doesn't practice medicine. They practice reductionistic medicine. Your research money, your amyotrophic lateral research money, your cancer research donations, your heart disease research money, your muscular dystrophy, cystic fibrosis money don't go to medical research. They go to allopathic reductionistic medical research. And allopathic reductionistic medical research has yielded hardly any results, poor to none results when it comes to coming up with a cure for chronic disease. Again, we've taken the wrong dog to the hunt. We've taken the wrong, given the money to the wrong philosophical branch of science. The branch of science that the MDs are best suited to interface with and to deal with is surgery and trauma cure when it's absolutely necessary. I mean, it doesn't get any more reductionistic than, a bullet in your arm, heaven forbid. That's as reductionistic as it gets. And that's what the MDs are best at. The stuff that they can do in the surgical arena is just this side of miraculous. And, as I am wont to say, whenever you have a hammer, or if all you have is a hammer, everything looks like a nail. So the orthopedic surgeon is going to tell you need the hip replacement, even though, in point of fact, you probably don't. The orthopedic surgeon is going to tell you that you need the knee replaced, when, in point of fact, you probably don't. Because, they only know what they know, and when they surround themselves with other colleagues who practice the same thing, it becomes reality by consensus. And they'll tell you, oh, no, you have bone-on-bone arthritis, you can't possibly regrow cartilage, and oh, no, that's, all you need is the knee replacement. And then you say, well, okay, doc, I'm going to get a second opinion, and you do a medical nutrition intervention and you grow the cartilage back and you recover from the arthritic condition, then you go back to the orthopedic doctor and they don't want to know what it is that you did to fix it. They don't. Because it is not in their wheelhouse. And they're not going to step outside of their wheelhouse, because if they step outside of their wheelhouse, they're not going to get paid or they're going to get sued because it's not in their scope of practice. And so insanity begets insanity, and the world collapses underneath the weight of ineffective, monopolistic, Machiavellian, mediocre medicine, which is what the MDs bring to bear in the treatment of chronic disease. You don't believe me? Well, you should. Facts are a stubborn thing. You're welcome to your own opinion, but not your own set of facts. While we've given the control of medicine to the MDs and the pharmaceutical and the insurance companies and the hospital industry, type 2 diabetes is skyrocketing. Obesity is skyrocketing. Alzheimer's has risen from obscurity to become the 6th leading cause of death. It's skyrocketing. Cancer, not a cure in sight. Amyotrophic lateral sclerosis, forget about it. Chronic diseases are getting worse. Life expectancy is getting shorter. We're going straight to hell in a handbasket, and it's for one reason and one reason only. We've taken the wrong dog to the hunt. We've given all of the money and all of the power and all of the control to the allopathic, reductionistically trained physician, and they've dropped the ball, and they've dropped the ball big time. But over the last 100 years, they have convinced us through, a psychological warfare campaign that the only real medicine is MD medicine and every other type of medicine is alternative quackery, right? You've been convinced that I practice alternative medicine. Well, I don't. I practice naturopathic medicine. Calling what I do alternative is like calling, a poodle an alternative dog. Now, the only real dog is a Great Dane. Those German Shepherds, those Golden Retrievers, they're alternative dogs. That's what it's come to in medicine. We are alternative to mainstream medicine, but mainstream medicine is mainstream not because it's better, not because it's more scientific, not because it's more effective, but because the MDs, the American Medical Association, the pharmaceutical industries have legislated themselves into the first place, and they stay there aggressively. Again, we do not have a free medical market. And if we did have a free medical market, within 5 years, the MDs practicing general family practice would be out of a job. They would be out of a job. Dr. Wallach gives a lecture about a month ago in Los Angeles. A couple of hundred people have registered to come. 1,200 show up. The fire marshal comes. They need to stop the lecture while they move, speakers to the lawn out in front of the pavilion that the event is taking place inside, because there's 1,200 people and the event can only seat 350. So why did so many people show up? Because over 400 people in a suburb of Los Angeles completely reversed their type 2 diabetes with medical nutrition. And they told everybody in their life about it, and that word spreads like wildfire. But again, the MDs don't care. They don't want to know. They don't care about it. And you should be extremely concerned about this. Because in point of fact, the startling fact of the matter is, again, your medical doctor may be the nicest person God ever created, but they don't know what's best for you. They only know what they've been trained in. And in a perfect world, it would be illegal for them to give you advice about other types of medicine that they have no idea about. So rather than the orthopedic surgeon saying, well, I don't have any experience with medical nutrition, perhaps you should give that a try, because I've had a number of patients who actually have recovered with medical nutrition and didn't need surgery. And here's the name of a doctor I'd like to refer you to. That's what they should do, but that's not what they do. What they do is, give it to you from their perspective, which I guess would hold up in court. Because if I didn't have any experience with Buddhism, or if I didn't have any experience with, born-again Christianity, I could say, well, that born-again Christianity stuff doesn't work. Because I don't have any experience with it. The MDs say that all the time, and we give them a pass. We need to stop giving them a pass. We really do need to stop giving them a pass. In my book, The MD Emperor Has No Clothes, which, by the way, you can get for free now, go to freedoctorbook.com, freedoctorbook.com, freedoctorbook.com. You can download my book for free. Is free good? Free's pretty good. If you don't want an electric version, you can get the old-fashioned softback. Go to drglidden.com, click on the store button. In my chapter on cancer, I have 10 questions that every cancer patient should ask their oncologist. I was thinking about this the other day. Actually, it's 10 questions that every patient should ask their physician if they're saddled with a chronic disease. Yeah, doctor, I've got type 2 diabetes, and I see that you're recommending metformin and glyburide, and I just have a few questions for you. Number one, does this treatment cure the type 2 diabetes? Does it cure it? Well, if it doesn't cure it, what can I expect from it? What are the side effects of the medication? What are you going to do to handle the side effects of the medication? How much is this all going to cost me? What percentage of revenue do you make from treating my diabetes rather than curing it? And why isn't there research being done in a cure? Because I read all the time about nutritional strategies which are extremely effective in supporting and promoting the structure and function of my body's ability to metabolize blood sugar. So why don't you know about that? And how much money is the hospital going to make from managing my diabetes for 40 years? And how much money are you going to make from managing my diabetes for 4 years? And I'd like the name of 10 of your patients, my age, my sex, my demographic, who've had the same diagnosis I have, and they've been patients of yours for 5 or 6 years. I want to talk to them to see how they're doing. Now, if every patient in the United States had a similar conversation with their MD when it came to the treatments that the MDs proffer up for chronic disease, very few people would undertake the madness. Because it is madness. It is Machiavellian, monopolistic, mediocre medicine brought to you by intellectual cowards who are unwilling to look outside of their box of unbelievable ineffectiveness. Fire your medical doctor, ladies and gentlemen. Get a clue. Get your health back. Tune in and turn on. We're back after these messages. Welcome back, ladies and gentlemen. Dr. Peter Glidden here, your steadfast advocate for health. Welcome to another live edition of Fire Your MD. And this is the deal, right? Because we don't know what we don't know, and most people, having no experience with, the ins and outs of science as it's practiced here, not just in the U.S., by the way, this is a worldwide phenomenon, just assume that their medical doctors are the best and brightest minds in science, and they're not. They might be the best and brightest minds in reductionism, and they might be the best and brightest minds in figuring out, robot surgeon stuff, but they're horrible. They are the wrong dog for the hunt when it comes to chronic diseases. They are 100% incorrect most of the time. And then the other percentage of the time, to 5, 6, 7, 8, 9% of the time, they're 90% incorrect. They're not 100% incorrect. They get it a little bit right, but they've completely thrown the baby out with the bathwater. Right? They'll tell you heartburn is caused by too much stomach acid. It's not. It's caused by not enough stomach acid. They won't be able to tell you the mechanism that causes heartburn because it doesn't exist. They'll tell you that your body has developed autoantibodies against self-tissue. They'll tell you that your body has developed antibodies against the thyroid, antibodies against the joint. And they won't tell you how. They won't even proffer an explanation except to use the old worn-out scapegoat. Oh, it's all genetics. And then when we hear the word genetics, we shrink in humility before the great intellect before us. I just did an entire webinar that blew the lid off of this whole concept of gene-generated diseases. It's called epigenetics. It's in the archives. Become an insider. Go to drglidden.com. Become an insider. $20 a month for a subscription to a couple of hundred hours of health webinars. One of which, the latest of which, is on epigenetics. You need to know these things, folks, and you need to know it before you get sick. Because there's a lot you can do with prevention. And also, when you're sick, you're scared and you're up against it. And you're going to do something. And, most people are just going to follow the herd, and they're going to go to conventional medicine because that's the only really option that you have. And the conventional medical doctors are the wrong people to go to for a chronic disease. You need to know beforehand what to do. You need to know beforehand how to support and promote your body's ability to optimize its structure and function. You need to know beforehand which foods to not eat. You need to know beforehand which nutritional supplements to take, how to take them, when to take them. You need to know these things. I mean, you figured out how to drive your car safely, right? That's a good thing to do because it helps you in your life. You figured out how to do rudimentary mathematics. It's a good thing to know. It helped you in your life. You figured out that you shouldn't pee upstream and drink downstream, right? That was a rudimentary skill. It helped you in your life. You put clothes on when you go outside, right? That helps you in your life. It protects you from the stress of the environment. You learned how to eat food regularly, right? Learned how to pay attention to your psychological state, right? There are life skills that we learn as we go down the track to make life easier. Well, there's a big skill set you were not taught and that you do not know. A gigantic skill set. A big piece of the pie of survival, Earth Survival 101 that you were not taught. It is impossible to secure all of the nutrients that your body needs in order to function properly from food. You cannot do it. It is impossible. You must supplement. And if you don't supplement, it's only a matter of time until your body reaches a point of nutrient deficiency and then something breaks and then you go to a medical doctor and they throw a drug at it and it doesn't fix it, it manages it. It gets worse and worse and worse and worse and worse and then you die. But before you die, you suffer. And it all could have been prevented with just a little bit of knowledge, just a little bit, not a lot. I'm not saying you don't have to go back to school. You don't have to get a medical degree. You don't even have to be smart enough to know how to spell vitamin. If you're smart enough to pass the driver's license test, then you're smart enough to know how to take care of yourself with new fashion, science-based, clinically verified, tip of the spear, holistic medical nutrition. And as God is my witness, the single best place to start in that inquiry is longevity. Longevity brings to the table the most effective nutritional supplement strategies I've ever seen. I've been doing this for 25 years. This is why I'm such a gigantic longevity cheerleader, because it is extremely effective in its effectiveness. That from the Department of Redundancy Department. Stick around. We're going to the phones when we come back. It looks like Robert in L.A. is up first. Thanks for tuning in. Welcome back, everybody. I'm Dr. Peter Glidden. You're a steadfast advocate for health. Let's get right to the phones. They are ringing off the hook. Robert in L.A. is up first. Hey, Robert, thanks for the call. You are live.
Hi, Dr. Glidden.
What's going on, Robert?
I wanted to ask you about a friend of a friend who's 32 years old, is 5 feet 2 inches, 165 pounds. She's 16 to 17 weeks pregnant. Has been told that the baby might have Down syndrome.
Yeah.
By other naturopaths, has been told that her body is kind of cold. I don't know if that makes sense. But primarily, the doctors tell her that she's low on the protein that gives oxygen to nurture the baby through the placenta. And so they also tested the baby's beats per minute, and it's 150. And they want to see if they can take blood out of the, pretty much, the baby, the fetus, I guess.
Well, stupid is as stupid does, and really all that the MDs have here is some type of heroic intervention. They see the body like a machine, like we're all robots, and, we just got to take a part out of here and give it over here, and they have no earthly understanding of the real motive driving forces here that are causing the facultative breakdown of all the bodily tissue and causing the trouble. From our point of view, Down syndrome is a deficiency in zinc. It's a deficiency in zinc, and it's interesting that you should talk about this now, because the webinar that I did last Thursday night alluded to this specifically, the relationship between a zinc deficiency and Down syndrome, and I explained how that happens on the webinar, so I would encourage this woman to become an insider and watch the webinar that I did on epigenetics. It's brand new. It's hot off the press, and it's been in the archives for not even 7 days now. So we have a interesting historical anecdote. I don't know if you ever remember the stunt car driver. He wasn't really a stunt car driver. Evel Knievel, right? He jumped motorcycles over enormous distances. Well, I believe it was his daughter-in-law, or maybe his daughter, I can't remember. She had the same situation. She, in her first trimester of pregnancy, she was pregnant, and her baby was diagnosed through amniocentesis with Down syndrome. And they got on board with Dr. Wallach's medical nutrition support program, and when the child was born, because they didn't want to have an abortion, it just wasn't their thing, the child wasn't Down syndrome. He was a normal, healthy child. So from our point of view, the body needs nutrition all of the time, and especially when it is developing in utero. In a perfect world, women would be nutrified with the 90 essential nutrients for 6 months before they even thought about getting pregnant, and they would have eliminated the 10 bad foods as well, so their body's stores can be filled right to the brim. And then throughout pregnancy, they'd be taking the 90 essential nutrients in order to just feed the baby, because the baby's body is growing too. You know, we can't go back in time, but the intervention here, if this were my relative, is I would put her on the 90 essential nutrients. So here's what I would put her on immediately as an immediate intervention. And if this was an effective intervention, it should produce noticeable results within 3-4 weeks, right? There should be a noticeable change in whatever the negative stuff that's going on right now. And remember, all birth defects happen in the first 90 days of pregnancy. All birth defects happen in the first 90 days. So we need to intervene quickly here. The recommendation would be eliminate the 10 bad foods, 1 Healthy Body Start Pack 2.0 liquid, 1 Healthy Body Start Pack 2.0 liquid, 2 bottles of selenium, 2 bottles of plant-derived minerals, and 1 bottle of de-stress per 100 pounds of body weight per month. 1 bottle of de-stress, 2 bottles of plant-derived minerals, 2 bottles of selenium, and 1 Healthy Body Start Pack 2.0 per 100 pounds of body weight per month. That's what I would do if I were her. I'd keep my fingers crossed, and I would see what would happen. The reproductive tract of the human body is extremely forgiving. The child needs nutrition. The mother's body needs nutrition. It is never too late to intervene. I mean, what do they have to lose, quite frankly? I would go for it if I were them. Thanks for the call, Robert. Alabama is up next. Cheryl, talking about an allergic condition here. This should be an interesting conversation. Hey, Cheryl, thanks for the call. You are live.
Hi. I really don't believe it's an allergy, but that's what my client/sister is suspecting, because I had to take her off the first calcium and put her on the Cal-Toddy, and she's had the same issues with the diarrhea/constipation on and off.
Okay, so something is happening, right? But it's not an allergy, because you can only be allergic to a protein. I mean, and a calcium is an essential nutrient. You cannot be allergic to an essential nutrient. You just can't. That's like saying,
okay,
well, I'm allergic to water. So something is going on here, but it's not an allergy. Okay? You're with me?
Okay, she's reading that is a possibility, that there's all sorts of people out there who have allergies to calcium.
She's wrong. So it's impossible to have, you can only be allergic to a protein. You know, I mean, this is one of the problems with the Internet, that there's stupid information put up by stupid people, read by people who didn't, you know, she probably didn't even have a biology class in high school, and she's listening to what these people have to say rather than listening to the medical professionals who are trained in this. So, you know, she can navigate her life by her own compass and reap the benefits thereof, but this is not an allergic reaction. If she's having a reaction here, the problem is with absorption. And the problem with absorption speaks to a small intestine that's been compromised by decades of eating wheat, barley, rye, and oats. The small intestine is the organ in the human body that absorbs nutrients, and if the small intestine has been compromised, it can't absorb the nutrients efficiently. So she'll take the calcium, she'll absorb a little bit of it, but the lion's share will pass into her large intestine where it creates trouble. There shouldn't be calcium in the large intestine. There shouldn't be any of the stuff that's in those supplements in the large intestine. It should all have been absorbed into the bloodstream. When it makes its way into the large intestine, because the small intestine has been screwed up, that's when it causes trouble. So this is a diagnostic indication that she has trouble absorbing nutrients, and that is all of the time caused by wheat, barley, rye, and oats. So the recommendation here is to eliminate the 10 bad foods and to take the liquid calcium and the other nutritional supplements in a more dilute fashion, extended out over time. Watch the webinar that I did on my Insider membership called Maximizing the Absorption of Your Nutrients. It's a telling webinar. It might help to bring her into the light, but you never know. You know, you can't fix stupid, like the fella said. Let's go to California and talk to Dora. Hey, Dora. Thanks for the call.
Hi, Doctor.
What's up, Dora?
Well, I had something odd. My left arm between my elbow and my wrist, it feels like something's crawling on my skin, kind of creepy-like.
Yeah, do you live with a Republican? Because that's probably it.
No, I don't. I live alone.
Okay, so the recommendation, so creepy crawly things in the skin, you know, that's an interesting thing to happen.
Yeah.
That speaks to not enough essential fatty acids, because the skin, if you were to look at the skin in a cross section, you know, like you cut a tree in half and you look at the rings on it. Well, if you were to do that to the skin, there are a number of different layers to the skin, and they're all kind of glued together, so to speak. They're all attached. And if the skin loses essential fatty acids, the layers between where the attachments of the different levels of the skin are can start to become kind of unlubricated and create friction just from moving around, and that causes an itchy, tingly sensation.
So I take EFAs, but maybe not enough.
Well, that would be correct. And also, if you don't have a gallbladder, that would be a problem. Do you still have your gallbladder?
Yeah, I have everything.
Okay, thank God. So how much do you weigh, and how many EFAs do you take?
That's the trouble. My arms are really thin, and my veins stick out too. So I don't know if that's
No, that's got nothing to do with it. So, you mean your skin is thin, or your arms themselves are thin?
Well, my body and arms are thin.
Okay, so how much do you weigh?
Oh, about 116.
116, and how many EFAs do you take a day?
I take about 4.
Okay, so here's what I'd like you to do as an experiment for 7 days in a row. I want you to take 9, 3, 3, and 3 of the EFAs. 3, 3, and 3. Take them with a meal. Take them with a meal.
Okay.
How much water do you drink?
I'm trying to drink a lot of water. Lately, I've been putting a jug on the sink that tells me to drink it all during the day.
Yeah, okay.
About 6 glasses.
All right, that's good enough. And put a little lemon juice. You know what you also can do is put a little lemon juice in about an ounce of warm water. Squeeze half of a lemon into an ounce of warm water and drink that down about 15 minutes before you have a big meal.
Yeah. And then a while back I called, I seem to be like a nuisance. I called back about selenium for varicose veins.
Yeah.
And then do the veins eventually go away, because I've had them for so many years?
Well, it's hard to know, right? I mean, I've seen varicose veins recede. I've never seen them disappear. That doesn't mean that can't happen. But generally speaking, the problem with varicose veins is that it's like the check engine light on the dashboard. It's an indication that the game is afoot. And the way that it goes in the human body is those are driven by copper deficiencies, right? So when you have, this much of a copper deficiency, you'll get hemorrhoids or varicose veins or spider veins, and then you'll get, gray hair or white hair. And then the larger arteries inside your body, like the carotid arteries or the big aorta coming off of the heart, their health will start to become compromised, and then you are a candidate for an aneurysm. and that's a big bad voodoo daddy. So whether or not the varicosities recede, if you are supplementing with the selenium that has sufficient levels of copper in it, then you will go a long way towards making your veins and your arteries healthy, so that that big bad voodoo daddy stuff isn't going to kill you, 10 years from now.
Well, I'm taking the selenium. You told me to take it like five a day.
Yeah.
Yeah, keep taking them, right?
Oh, yeah, I take 12 a day. I take 12 a day. I'm 200 pounds. I take 12 a day.
And you don't have varicose veins.
No, and God willing, and the creek don't rise, that ship is not going to sail either. So
in my weight, 5 is not too many a day.
No, you can tell. I've seen there's a handful of people that have a reaction to selenium, and which means they're taking too much, and it really is independent of their body weight. Nobody really knows. But if you or anybody else takes too much selenium, you'll get garlicky or fishy breath. You'll get brittle nails or brittle hair. If any of those things start to happen, you just back off by selenium by 2 or 3 capsules a day, and you should be good. But those are telltale symptoms that your body has taken too much. Give that a try, Dora, and let me know what happens. Ladies and gentlemen, much more to come. I am Dr. Glidden, and this is Fire Your MD Now. I know what you're thinking. Dr. Glidden, what'd you do with the money? The money for singing lessons. Check out the live stream. I know you want to. TheDrGliddenShow.tv. Marie in Arizona is up next. Hey, Marie. Thanks for the call. How hot is it in Arizona today?
It's quite cool. It's only 85.
I was in Arizona in August, and man, oh man, that was hot with a capital H. It wasn't hell, but you could see hell from my hotel room. That's how hot it was. I don't know how you guys deal with it in the summer. Of course, I guess most people don't know how we deal with the cold in the winter. So I guess that sword cuts both ways, right?
Yeah.
So hey, Marie, enough of this small talk. Thanks for the call. What's up?
Well, my husband's been on the protocol for about 10 months. He's got acid reflux disease. Yeah. He's got a non-functioning valve at the esophagus, and acid, sloshes up. He's had reduced gas, but he's still burping up, acid into his esophagus. And
all right. Is he getting any traction at all from the program? Has anything dramatically improved in 10 months?
Well, he stopped farting like crazy.
What about mood, energy, sleep, aches and pains, arthritis, blood pressure, anything?
Generally, his health has improved, yes.
But he's still stuck with the digestive issues vis-a-vis heartburn and stuff like that, right?
Yes.
Okay, now, if before he started the program, on a scale of 1 to 10, the heartburn was a 10, what is it now?
Probably an 8.
Okay, so there's been a little bit of improvement. That's good. So, how much does he weigh?
About 190 pounds.
Okay. And so here's what I would like him to take for 2 weeks as an experiment to see if it makes things better. Okay?
Okay.
2 weeks. We're looking for a dramatic improvement in 2 weeks. All right. So has he gone gluten-free? Has he stopped eating the 10 bad foods?
Yes, absolutely.
Excellent. Is he salting his food so that it tastes good?
Yes, plenty of salt.
Excellent. Okay, great. So here's what I would like him to do every day for the next 14 days. Please, I'd like him to do 1 ounce of the liquid calcium, not the powdered calcium.
That's
1 ounce of the liquid calcium in 1 ounce of orange juice 4 times a day. And I want the last dose to be before bed, immediately before bed. 1 ounce of the liquid calcium in 1 ounce of orange juice 4 times a day. Okay?
Mm-hmm.
I want him to take 2 digestive enzymes at the beginning of every meal. I don't care if it's breakfast, lunch, or dinner. I don't care if he eats a cracker. I want him to take 2 of the digestive enzymes at the very beginning of every time he eats. 2 of those. Okay?
Okay.
I'd like him to do 1 scoop of the Beyond Tangy Tangerine in 12 ounces of water. 1 scoop of the Beyond Tangy Tangerine in 12 ounces of water 4 times a day. 4 times a day. And I want him to take at least an hour to drink each dose down. 1 level scoop of the Beyond Tangy Tangerine in 12 ounces of water 4 times a day. And lastly, 2 EFAs with breakfast, 2 EFAs with lunch, and 2 EFAs with dinner. Now, I want you to go to the health food store and get a little bottle of extract of peppermint oil. And every time he starts burping and belching, I want you to put 2 or 3 drops of peppermint oil in about an ounce of warm water, a little bit of warm water, and have him swallow it down every single time he starts burping and belching, and see whether or not this combination of things makes traction with the heartburn. Call me back in 14 days after he's done it. We'll talk about his experience, and I'll tell you what to do next. And I appreciate your trust. Go for it. 14 days. I'll be looking for the call back, and we'll see what we can see. Hour 2 coming up, ladies and gentlemen. Where does the time go? Again, please join the live video stream and the live chat, the drgliddenShow.tv.